Well, chargemaster data is almost uninterpretable to the everyday American, but it's a first step towards greater price transparency that's desperately needed right now. And I think over time, technology groups and navigation apps will consolidate the data and provide it with an easy user interface so that you'll be able to look up when you need to deliver a baby that Hospital A has an average markup of twofold the Medicare allowable amount, which may be a reasonable markup given the quality of care. That is, markup should not be a negative term. People are happy to pay more for better quality. But for the same quality service, if Hospital A is offering it for a twofold markup and Hospital B is offering it for an eightfold markup, if a technology company can consolidate and aggregate that data so it's understandable to the everyday consumer shopping for care, it could be a very powerful tool in healthcare. Now, some people would say, look, consumers don't use pricing information in healthcare, and when they do, they just pick the more expensive service thinking it's higher quality. Well, that may be true for a small group of people who are not paying directly, but by and large, markets are driven by proxy shoppers. That's the fraction of consumers who are shopping on price diligently. We know those people at the grocery store. They will compare a lemon at grocery store A to a lemon at grocery store B, and they are aware of an individual change in prices. When people look at gas prices the same way sometimes. I like going to, place A because it's 2 cents cheaper on the gallon. Now, I personally don't really shop on a penny level when it comes to gas prices, but those other proxy shoppers drive the market so the prices come down for everybody, including shoppers like me. Health plans, employers, the out-of-network patients, these are proxy shoppers in healthcare that can have a powerful impact even with chargemaster prices. Ultimately, I think medical centers are going to see the benefit of offering honest and fair prices. When I say honest and fair, I mean it doesn't change sixfold depending on who you are or where you live or who your employer is, but a standard, flat, all-encompassing price that doesn't come with surprise bills that, hit you 3, 6, and 10 months later. And the market will reward those disruptors. We've already seen it with bundles that are now sold on the market for services. We've seen it with the Surgery Center for Oklahoma. We've seen it with members of the Free Market Medical Association. People are hungry for honest and fair pricing.